Hello, my name is Giovanni. I'm going to be your nurse today. I'm going to wash my hands for 20 seconds. I'm also wearing a mask and a face shield. I understand you're having difficulty speaking right now. We're going to go ahead and communicate using thumbs up and thumbs down, alright? So thumbs up is going to be yes, and then thumbs down is going to be no. I'm going to check your wristband here. Is your name John Johnson? Thumbs up, okay. And is your birthday 10/12/1960? Thumbs up, yes, okay. I see you don't have an allergy band, so do you have any allergies I should know of? Thumbs down, no, okay. And then, are you in any pain right now? Thumbs down, no, okay. I'm gonna go ahead and check your wristband now, or scan your wristband, I mean. Okay, identity's checked. Today I'm gonna be doing some care on your tracheostomy. So your tracheostomy is the device that you have on your neck there that you're using to breathe. So today I'm going to be doing some suctioning, which is just basically going to be removing some of the secretions and mucus out of your upper respiratory tract. Then I'm going to change the inner cannula, which is a part of the tracheostomy. Then I'm going to clean the site and I'm going to change the dressing, okay? So it shouldn't be painful, but moving around the tracheostomy can cause you to have the urge to cough, so that is normal, right? But if you're experiencing pain, I want you to go ahead and raise any of your arms during any point during the procedure, okay? And then we'll stop and figure out why it's being painful, all right? Okay, do you have any questions for me before we get started? Thumbs down, no? Okay. So before we get started, I am going to check that I have all the emergency equipment to keep you safe. So I do have 2 tracheostomies. One is the current size, which is size 8, and then another tracheostomy that is a size smaller, which is a size 6. I also have my ambu bag attached to oxygen. It's running at 15 liters as previously documented. I'm going to check to actually make sure that it's moving air. Okay, it is. I see that your oxygen source is attached to oxygen. It's running at 3 liters as previously documented. And then you have a suction catheter that's attached to a suction canister. And I will check the pressure and actually change the catheter later on, since I'm not sure when it was last changed. I'm going to put you in high Fowler's position. And then I'm going to go ahead and close your curtain for some privacy, right? Okay. So I see that your oxygen saturation is actually only 92 right now, and your respiratory rate is actually 24, which is a little high. Are you having difficulty breathing right now? Thumbs up, yes? Okay. I'm going to go ahead and listen to your lungs to see where that is, alright? Give me a deep breath. Okay. One more. Alright. Another deep breath. And one more. Okay, so I do hear some secretions in your upper respiratory tract, so I think that is why you're having that difficulty breathing, okay? So we will go ahead and do that suctioning later on, okay? I'm gonna wash my hands for another 20 seconds, and I'm gonna proceed with cleaning my, my workspace. So I'm gonna wipe the table down for 30 seconds, and then allow it to dry for 2 minutes. Okay, that was 30 seconds. I let the table dry for 2 minutes. I'm gonna do hand hygiene for 20 seconds again. Okay. I'll put my gloves on. And now I'm actually going to prepare my kit. So with me I have my tracheostomy clean and care kit. I also have a neck stabilizer, or the tracheostomy stabilizer. I have an inner cannula, I have saline, and then I have a new suction catheter with me. So I'm going to start with opening up my care kit, and I'm going to put this sterile drape on the patient, only holding on to the 1-inch border. So Sorry to reach across like this. Okay. Now I'm going to remove these gloves and I'm going to go ahead and put in my inner cannula. Okay. Toss that. And now I'm going to open up my saline, pour that into the tray. And I'm going to set up the box for my suction catheter. I'm going to open that up, pour some of the saline in there. Okay. And then I'm going to use these gloves to remove the old suction catheter. Okay, remove the old suction catheter. Gonna wash my hands for 20 seconds again. And I'm going to put on the new suction catheter. Okay, got my new suction catheter here. Gonna go ahead and put that on. Okay, I got my new suction catheter on, so while I'm here, just going to check to make sure that the suctioning is working properly. Gonna go ahead and get some fluid. Okay, so the catheter is working properly and the pressure is at 120 millimeters of mercury, which is the appropriate pressure for suctioning. Okay. I'm gonna do hand hygiene for 20 seconds, and I'm gonna educate the patient on the next step. So since your oxygen saturation is still 92, I am gonna have to hyperoxygenate you. So all that means is I'm basically gonna give you a lot of oxygen right before the suctioning, okay? So I'm going to make sure that I only suction for 10 seconds, a maximum of 10 seconds. That way I don't have you without you breathing for too long. And then lastly, I'm gonna take a lot of care to make sure that I don't touch the plastic covering of the catheter to your tracheostomy so we prevent infections, okay? All right, we'll go ahead and proceed with that. I'm gonna remove your oxygen source, okay? Okay. Going to get my ambu bag. I'm going to stabilize the trach and give you 2 breaths, 6 seconds apart. Okay, your oxygen saturation is now 98. I'm going to advance the catheter until I feel resistant. Okay. All right. So I would wait 30 seconds between passes. I'm going to put your oxygen back on. How was that? Thumbs up? Okay. So I see your oxygen saturation is at 97, which is good. That means it's holding. Do you think you need another pass? Thumbs down, no? Okay. Just to make sure, I'm going to listen to your lungs, okay? Go ahead and give me a deep breath. And another one. Okay. And then give me a deep breath. And another one. Okay. So your respiratory tract sounds a lot clearer now, which is good. So I see your oxygen saturation is still at 97. So I think that was good. Cleared up those secretions. Gonna do hand hygiene again for 20 seconds. So this next part, we're gonna do a cannula change, okay? The cannula is that part of the tracheostomy that I told you about earlier. So I'm gonna use my non-dominant hand to remove the oxygen source, and then my dominant hand to remove the tracheostomy. I mean, not the tracheostomy, the cannula. Okay, gonna remove your oxygen source, stabilize your tracheostomy, remove the old inner cannula. Now I'm gonna grab the new cannula, only by the end, like so. Now I'm gonna go ahead and insert that and advance until I hear a click. Click, okay? I'm also gonna remove this dressing while I'm here. You're gonna feel a pulling sensation, okay? All right, now I'm gonna put your oxygen source back on. I'm also gonna assess the site while I'm here. So I see that the neck stabilizer is still in good condition, but I'm gonna replace it anyway. I see that behind your neck and on your neck, there are no signs of pressure injury or any redness or swelling or a sign of infection. Also, your tracheostomy does not appear to be cracked or leaking in any way, and your inner cannula is now securely attached. Okay. Your oxygen saturation is 97, which is good. How is your breathing feeling? Thumbs up, good? Okay. Going to perform hand hygiene again for 20 seconds. So this next step is going to be the cleaning, okay? So unfortunately, this cleaning does take a little bit longer, but I'm gonna try to be quick. That way you're not without your oxygen for too long, okay? I'm gonna prepare my supplies, which are just my gauzes and my cotton swabs. Okay. I'm gonna remove your oxygen source, okay? So I'm gonna dip this cotton swab in the saline. I'm gonna do one swipe below the faceplate. Okay, toss that. Gonna dip the next cotton swab in saline and clean underneath the faceplate in one swipe. Okay. Now I'm going to grab a cotton gauze and I'm going to dip this one in the saline as well and clean below the faceplate with one swipe. Okay. Gonna grab another cotton swab, dip this in saline as well, and clean below the faceplate in one swipe. Okay. Another cotton swab in the saline. This one we're actually gonna clean the faceplate. Okay. Next cotton swab is going to be dry, or not cotton swab, gauze. Is going to be dry, and I'm going to use it only to dry the faceplate. I'm going to pat dry. Okay, and then the last gauze is just going to be a split gauze. This is dry. And I'm going to actually keep underneath your tracheostomy. You're going to stabilize the tracheostomy. Stabilize this edge. Slide that gauze underneath. Okay, I want to give you your oxygen and check your oxygen saturation. Okay, it is 97, which is good. That means your oxygen saturation is holding. How is your breathing? Thumbs up, yes? Okay, that's good to hear. All right, so we're almost done here. I'm gonna remove my gloves and perform hand hygiene. The next step is just gonna be to change your neck stabilizer, okay? But I do need another nurse here with me to actually change that, to help me change that, to stabilize the trach. So I'm gonna go out and get them, okay? But I am gonna leave you with your call light here. So you go ahead and press that if you have difficulty breathing, and I'll be in fast. I'm also gonna lower your bed. And then I'm gonna put your guardrails up, okay? I'm gonna clean my hands. All right, I will be right back, all right? Hello, so we're back. So we're gonna be doing the last step. We're going to be changing the neck stabilizer, all right? So I am gonna have to remove your oxygen. So we're gonna try to be quick so you're not without your breathing for too long, all right? I'm going to prepare the neck stabilizer before I remove the patient's oxygen. Okay. So we're going to do 3 assessments here. I'm going to go ahead and check the skin on the side of the neck and on the 2 sides of the neck and behind the head. So I'll do that now. So I see there are no signs of redness or swelling or infection or pressure injury on the side of the head or behind the neck. Or the side of the neck and behind the neck, I mean. Okay, are there any signs of redness or swelling or pressure injury on your side?
No.
Okay. So we're gonna do a 2-finger check just to ensure that there is a proper fit. Okay, I'm gonna go ahead and give you your oxygen back, all right? Okay, how was that? Have any pain? Thumbs down no. You're breathing a little bit better? Thumbs up yes? Okay. I'm gonna go ahead and listen to your breathing once more, okay? I see that your vitals, your oxygen saturation is still holding at 97, and your respiratory rate is 18, so which means your breathing has improved. Give me a breath, please. Okay. Go ahead and give me your breath. All right. Another breath. Another breath. Okay, now I'm going to check that our emergency equipment is still working. So I'll check the suction catheter just to make sure that it's working if we need to suction again. Okay, I'm also going to check the ambu bag. Looks like it's still connected to our oxygen, still set at 15 liters, and it is still moving oxygen. Okay, so now I'm going to continue with our documentation. So I'm going to document the date and the time of the suctioning, as well as the patient's tolerance to the procedure, their pain, the results from my site assessment, as well as the amount of sputum and the color produced. So I'm going to clean up. I am going to leave you with the call light. So if you have any difficulty breathing, you can go ahead and hit that and then we'll be in fast. I am going to go ahead and lower your bed all the way down. Then I'm going to put your guardrails up. We're going to do hand hygiene once more before we leave. Okay, thank you. We'll be back soon.